ورحمة الله وبركاته. Hello everybody. With you, Dr. Rami Bakko, leader group 2. In the presentation, I am the patient. Okay. We are happy to see you and Ramadan Kareem, inshallah. Okay. These are objectives for our presentation and outline what we will present. Case scenario, differential diagnosis, examination, required investigation, and final diagnosis, and overview for final diagnosis, and pathophysiology for final diagnosis, and risk factor for final diagnosis. And after that, we will talk about treatments and management for final diagnosis. At the end, we will talk about complication and warning sign for final diagnosis and how to prevent final diagnosis. Okay? But let me tell you how we will show our presentation. Our presentation will be theoretical form, okay? But before we start, let me ask to postpone your question to end the presentation. Sorry for that, but I think we will answer all of them during the presentation, inshallah. Okay? Have fun and enjoy, inshallah.
Assalamu alaikum.
Wa alaikum assalam wa rahmatullahi wa barakatuh.
My name is First Abdominal. May I ask some questions?
Yes, go ahead.
So may I start with your name and age?
My name is Rami and I am 61 years old.
Can you tell me about your pain?
Yes, it was suddenly and I felt tightness in my chest and my abdomen.
Yes, but yes, it's a pain.
Yes, doctor, the same pain in my jaw and my arm.
Is it also for anything?
No, it isn't.
It is associated with nausea and weakness.
Yes, doctor.
Do you smoke?
Oh, sorry. Yes, doctor, sorry for doing that. But I am kind of a smoker. I smoked 10 cigars a day for 30 years.
Did anyone of your family have the same symptoms?
No, I think.
Well, you are finished.
But I have diabetes type 2 and hypertension for 10 years. Also, I was diagnosed with stable angina for last year.
Right. So, you finished.
Okay, how am I, doctor?
Well, depending on the information you gave me, I can think of multiple diseases that are caused from multiple organs, such as from gastric region, when we have esophagitis, gastritis, or cancer, including gastric or the ulcers, or maybe hypertension, or gastric obstruction, or maybe gastroesophageal reflux disease, or even cancer.
All this for my stomach, right?
Yes, and from the governor, I can think of all these, and they are clearly cases with the stones, clearly cases, like stones, cholestasis, we mentioned the governor, or meningitis, we mentioned the governor. And from the gastric region, we have pancreatitis or cancer of pancreas.
There are other organs.
Yes, from vascular region, we have all the section, which we give you certain tightness in the chest, and we get the jaw and down the arm. On the ischemia, which we give you certain tightness in the abdomen. And from cardiac region, we have pericarditis or acute coronary syndrome, which we give you certain tightness in your chest and upper parts of the abdomen, and we get the jaw and down the arm. And it's usually associated with having stable angina and weakness and nausea.
Doctor, then does it mean I have acute thing syndrome?
Yes, or maybe it's caused from other regions, such as testosterone, shingles, constriction, or muscle strain, or metabolic disease, including osteoarthritis and Crohn's disease.
Doctor, my bowel in abdomen, not in my chest.
Right, but we have multiple diseases, and for that we need to do some physical examination.
Okay. Okay, doctor, how did I do?
Well, for clinical examination, I can say let's work in vein, as spine is weakened, indicating no good, no clinical practice, and no edema indicating no failure. For your vital signs, the temperature was normal, so we usually get no dimension, no infection take place, and your pulse was low, which is usually associated with acute coronary syndrome. For your blood pressure, it was high, which is usually indicates acute coronary syndrome, but suspicion of septicemia. For respiratory rate, it was high also, so we can which is usually indicated when you rate of 100 pulmonary disease, and your oxygen suppression was normal. Lastly, your GBD was disaggregated, which is usually associated with ACS. Your chest examination, cancer examination, they show normal results. So we can exclude pulmonary disease, but we can't exclude acute syndrome, which may not result in cancer examination. For your other examination, it was normal, so we can exclude pancreatitis, osteoarthritis, cystitis, and pharyngitis.
Okay, doctor, blah, 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 blah. I misunderstand what you see. Can you tell me what's my problem, please?
Well, we can't be sure unless we do further investigations, and for that, Dr. Omar will tell you about it.
Okay.
Hello, good afternoon. Are you right?
Yes.
Are you okay?
Well, I'm okay. I don't present you.
Okay. Unfortunately, we didn't know what is your disease yet. We will perform some investigations. Dr. Fahad has exclude some disease. So I will ask for CBC to check if you have any malignancy, ECG due to your chest pain. Also ultrasound, chest X-ray, cardiac biomarker, and other disease. See you. Okay. 2 hours later.
Okay, doctor. Can you explain my result, please?
This is the result.
Yes.
This is the fastest result I've ever seen. Is this the progression of medicine? Wow. Okay. I will explain to you. Your hemoglobin is normal, so you don't have any malignancies. But your red blood cells is high. That can be due to the irritation, due to heavy smoking also. Your urea, platelets, and electrolytes are normal, so don't worry about them. Your fasting glucose and lipid profile indicate a major risk factor for cardiovascular disease, and the troponin is high, and according to Roman basic pathology, it increases normally in case of myocardial infarction. In case of myocardial infarction, due to leaking out of injured cell through damaged membrane. And your X-ray are unremarkable, so I will exclude pericarditis also. And lastly, the ECG. Can you look at screen, please? The sinus or pericardia, because there are slow rhythm, and look at lead 2, see if there are ST elevation in lead 2 and lead 3, and IVF. Did you understand anything?
Please, Dr. Moore. I understand, of course. Please, what's my problem?
Your problem is acute coronary syndrome, ST elevation, inferior myocardial infarction.
Is this serious disease? Is this cardiac disease, doctor?
Don't worry, I will introduce you to my colleague, Dr. Khalid, to give you an overview about the disease. So,
I'm sorry. No, doctor. What's your mind? And why the previous doctor say that I have inferior myocardial infarction? Is this serious disease?
Before I answer the questions, I have to tell you from where your heart gets its blood. Your heart is supplied by the coronary arteries. These arteries arise from the ascending aorta. The most important thing that the inferior wall of the heart and the conducting system is supplied by the right coronary artery, except for the right fundamental branch is supplied by the left coronary artery. And so regarding your questions, MI is a necrosis of the heart muscle due to ischemia. This ischemia can be caused by vasculitis, emboli, trauma, or even vasospasm. But because you have hypertension and past history of stable angina, and also the vast majority of MI are caused by atherosclerosis. And why did the previous doctor say that you have an inferior wall MI? Because the atherosclerotic plaque has formed in the right coronary artery. Atherosclerosis is an inflammatory response. The journey begins when there is an endothelial cell injury. This injury can be caused by hypertension or toxic exposure like cigarettes. These sites, the sites of injury, are prone to the deposition of lipids. At this moment, the rise lesion called factor 3. Also, the dysfunctional endothelial cells will express adhesion molecules. So the leukocytes will adhere, they migrate, the monocytes will do the same, but the monocytes will further differentiate into macrophages and foam cells. Foam cells are lipid-laden macrophages. These foam cells will release pro-inflammatory cytokines, leading to further leukocytes migration. But the journey doesn't end here, unfortunately. This blood eruption causing, it's expressing its thrombogenic matrix, so the platelets immediately will adhere, aggregate, activate, releasing thromboxane A2, adenosine diphosphate, serotonin, leading to further replication of the platelet, and the journey ends with complete occlusion of the artery. So, as a parametric review, we divide the infarctions into subendocardial infarctions and transmural infarctions. And to make this information easier to take, imagine that I'm the only oxygen supplier in this room. There's no oxygen without me. If I die, you're all gonna die with me. So I cut the oxygen. The first people who will die, those in the heart. Because the last oxygen atoms I will give, those in front of me will take it. It's the same in the heart. It replaces me with the right coronary artery, and you will be replaced by the myocardium. Transmural infarctions, it means that the whole thing of the myocardium is infarcted, and subendocardial infarction is 3 minutes. Subendocardial infarctions, it means that the farthest point from the artery is infarcted. As a consequence, chemically, the aerobic metabolism will stop, leading to accumulation of noxious metabolites like lactate, functionally to lose its contractility. Morphologically, it will first for us we will not see things except for mitochondrial swelling, and the rest of the first day we will see coagulation necrosis, necrosis of the nuclei, beginning of neutrophilic infiltrate.
Okay, doctor, why I have tightness in my chest and my abdomen?
Because your heart is the carrying fibers will go to T7, T8, T9, so you will feel pain in your epigastrium. Also, because the second intercostal nerve will give the lateral branch to the medial cutaneous nerve, leading to giving the intercostal brachial nerve, so you will feel the pain in your heart.
Okay, and why I have sweating and nausea with pain?
Also, you have a bradycardia. All these are neural effects.
Okay, doctor. Why me? Why this serious disease hit me? There are a lot of people in my age, and they are still healthy.
Because you have a lot of risk factors, and that's what we will discuss with the next doctor, Dr. Muhammad. I'll call him. Dr. Muhammad, please, I need you here. Dr. Muhammad, this is Mr. Harm. He needs to know about the risk factors. Okay.
1 minute.
دقيقة معلش. دكاترة معلش يعني. احنا تعبنا.
So as my colleague said, the augmented risk factors and age is not the only one. Include 1, lack of physical activity. Physical activity may reduce 20% to 30%.
Just mention the risk factors, don't explain everybody.
1, physical activity. 2, alcohol consumption. 3, smoking. 4, diabetes mellitus. 5, dyslipidemia and CAD. 6, hypertension. 7, obesity. 8, gout. 9, age, as you said. 10, gender. Any risk factor of these is not allowed to go to hospital and get the hospital.
Okay, doctor, I want to get better. What I am going to do now?
We will do the history contribution, so now I refer to our cardiologist Joseph. He will explain it.
Good afternoon, Dr. Rani. I see that you've been informed about your current diagnosis, and I know it's a very serious one, but we're going to try our absolute best to treat you and give you the proper treatment, all right?
Yes, I trust you.
Perfect. So first we're going to have to stabilize you with our very acute treatment that we're going to give you right now. So the very first step is we're going to probably give you morphine, all right? It's a very good analgesic. It's going to reduce the pain in your chest, right? Morphine, we're going to give you oxygen to resupply your heart, we're going to give you sublingual nitrates, and probably aspirin and clopidogrel, right? Very good blood thinner. After that, we'll move on to the crux of the treatment, which is the interventional treatment, where we're going to actually fix the infarction in your heart. The number 1 treatment, PCI, percutaneous interventional coronary intervention. We're going to thread it in, open up the blood vessel, let it out, all right? If that's not available, we'll give you thrombolytic treatment like streptokinase or TPA. And after everything is said and done and you're feeling a lot better, we're going to move on to our long-term treatment, which consists of lifestyle changes. You're going to have to start eating better, lose weight, stop smoking, stop alcohol when you drink. And alongside all these lifestyle changes, we're going to prescribe you a lot of pharmaceutical treatments. You're going to have to stick with religiously from now to a very long time. From these include aspirin, like we gave you initially, clopidogrel, beta blockers, decreases the sympathetic tone, decreases the preload, decreases the workload in your heart. We're going to give you ACE inhibitors, the number one drug is going to reduce your blood pressure, and we're probably going to give you statins like this.
Mr. Please stop. Why will you give me all this medication? I don't want it. I want to do any operation, okay? Are you sure, doctor?
Sorry, what just happened?
Our patient is scared, he's refusing treatment.
Please calm down, Mr. Rami. I'm Dr. Muhammad Al-Awfi, senior cardiology department. What's your problem? Can you tell me what just happened?
There are a lot of medications. Also, to be honest with you, I am afraid from operation.
Okay, well, your condition is a serious one, and you will have multiple serious complications, and some of them are fatal, like hypotension and cardiogenic shock and ventricular thrombosis due to the decrease of the contractility of the heart. Also, your heart will be arrhythmic because of the electrical instability. Also, there is a serious complication which is a ventricular septal defect that can cause hypoxemia and last medical damage.
Alright, let me see that. I will restrict with treatment and I will do operation inshallah. But I have some question. What happened and what should I do after that?
There is a high chance that the condition will become more stable, therefore you can go to your home safely. And if you start feeling any pain or discomfort in your chest, or shortness of breath, or pain on the left arm and shoulder, or lightheadedness and nausea, these are a sign that you are in an urgent need to go to get the medical assistance. So please call 997 and ask for medical help. And I hope you will revive from your symptoms in no time.
Okay, doctor. Thank you. I'm sorry, Dr. Yusuf.
At the end, we should know how to prevent multiple serious conditions in our life. First of all, by avoid smoking and manage diabetes if you are diabetic patient, and be physically active every day, should a good nutrition, aim for a healthy weight, finally reduce stress.
Okay, thank you for listening and your time. The presenter, Dr. Omar, Dr. Muhammad Al-Awfi, Dr. Muhammad Shamri, and Dr. Yusuf, and Dr. Fahad, and Dr. Abdullah, and Dr. Khalid, and with you, Dr. Rami. Okay, for any further information, you can check the reference. These are our reference. Okay. Have you any question?